best rural doctors in America. They get as much full scope training as you can, just short of being cowboys, right? I mean, they can keep as much care in your local facilities as possible. Well, they send them overseas for 6 months to work in an African hospital, okay, and then 6 months of training here. Also involved as a tropical medicine training course. Well, I was visiting with them and actually recruiting one of these fellows as we talked about it, and he said, well, I'm going to Zimbabwe next fall. How serious are you about this mission focus thing? I said, well, I'm serious. It sounds fun. It sounds like a great thing. We sure support you doing it. He's like, well, then come. And I'll be darned if getting to know that guy didn't. 6 months later, I'm on an airplane, flying 30 hours on an airplane to a hospital that is 3 hours from the nearest metro area in one of the most remote and impoverished parts of the world. And what I didn't understand until I got there and I got back was I went to put malaria screens on windows. So they're really not even mosquitoes. They have bed nets. It's not about the mosquitoes. It's so that the cobra snakes couldn't get into the bedrooms where missionaries were sleeping and bite them on the way to the bathroom in the middle of the night. Okay, that was what I thought. I'm going to go help these people. I'll put malaria screens on windows. I'm a handy guy. I can put these things together. I didn't realize, they knew it, but I didn't know it, my life would change because I was there. So we get back, and I brought somebody from our maintenance department as well, and I will never be the same for going over there. But the more that the village of Ashland, Kansas is connected to the village of Karanda in Zimbabwe, the more the village of Ashland changes. And it changes for the better. Because it isn't just about eradicating poverty. I mean, there's so much more that comes with that when people are exposed to other people on the other side of the world. Because in rural communities, what are we about? We're about relationships, right? We're about, I've known that family for 20 years, and I know that they're good people, and I know I can count on them when I am. We're in such remote areas that we have to count on each other. And so lives change that way as well. So where do we find these mission-focused professionals? Do you want to go